Do you have a dull ache or pain in your shoulder that is constantly bugging the life out of you? Or maybe you just can't sleep properly because you think that this pain will never go away. Hi, I'm Pat, and in this video I'm going to share some tips with you on identifying and enabling you to self-treat your issue and your shoulder problems with some various techniques and some stretches, and also the key benefits of deep tissue massage and what they may have for your issue and your shoulder problem. So what are the key benefits to deep tissue massage in regards to your injured shoulder? Here's the top 5. Number 1, promoting blood flow and prevent scar tissue from building up around the affected area. Number 2, massively increases your range of motion. Number 3, helps keep your muscles more supple and flexible. Number 4, reduces the risk of reoccurring injuries. Number 5, helping you get back into action, whether that be at work, at the gym, everyday life, just life without pain, even just getting off the couch could help you do that. Sometimes when we're at home or at work or with the kids or at the gym, we get that little twitch or niggle in our shoulder and we just think, it's going to be fine, just leave it, it'll be all right. And hoping that it'll go away. In most cases, it doesn't go away. Sometimes it does to the lucky people, but not all the time it does that. If anything, over time, the longer it's left or ignored, the more irreversible the damage is going to be in the long term. So here are 2 examples that might be relevant to you and your issue. The first one, when you're sat in the car and you've got the kids in the back and they're being an absolute nightmare. They've dropped a toy or they've done something, so you end up reaching round, trying to grab something, and the next thing, you've just felt that little twitch or niggle just go in your shoulder. Second one is something as simple as putting on a t-shirt. That's when you're trying to put on a t-shirt, and the next thing, you feel that twitch. The back of the shoulder, front of the shoulder, whatever it may be. It's just letting you know that it's there. So if you've had a twitch, pull, niggle, or strain, then here are some techniques for you. Okay, so you've got your tennis ball in the sock. You're going to place it on the area that's injured. So bring your feet slightly forward just so you can add a little bit more pressure, and then not too much, and then just slowly just glide over that area. Just try and get a bit of blood flow in there. Just get it nice and warm, and then when you find that pinch where that injury is, once it's nice and warm after a couple of minutes, bring your feet forward a little bit more and then just lean back and just add a little bit of more pressure. And then after that, slowly raise your arm. And then try bringing it out. Remember, no sudden movements. No, you don't want to be drawing the muscle. You're just going to irritate it and make it worse. And then slowly rotate. That's it. And then bring it back. See, when you feel, because you're turning the muscle on the ball, that in itself makes such a huge difference. Nice fluid movements. And remember, this might be a little bit painful to do at first, but don't worry, because your threshold, the more you do it, your threshold will increase. And then just go back. Just rolling it. At the moment, this is a tennis ball. I mean, you can upgrade, as it were, and use what's called a lacrosse ball, which is much firmer, or if you really want to take on board a little bit more pain, try a golf ball. And with it being much smaller, it really gets into those tighter areas. But a tennis ball, I think, is if you're doing this for the first time, then use something nice and soft like a tennis ball. Makes it more bearable. If you or any of your friends think that you may benefit from this video, then please comment below, like, share. We truly appreciate it. Thank you very much for watching, and I'll see you next time. Remember, prevention better than cure.